Hi, I'm Dom Costabile. I'd like to share with you an area of my practice that I've been practicing in and learning about since about 2017. It's called RECODE, or Reversing Cognitive Decline. I've had the privilege of studying under Dr. Bredesen, and this has been one of the most paradigm-changing areas in my professional career. Prior to this time, we've had 3 series of medicines to treat cognitive decline, or dementia as you know it, or Alzheimer's. There are multiple causes of dementia, and Dr. Dale Bredesen, through years of work, not just him, but other scientists, have categorized the areas that drive cognitive decline into 5 categories. One is called nutritional deficiencies, the second is called inflammation, the third is called viral, which means an area that's caused by Lyme's disease, heavy metals, and many other provocative things. Finally, stroke or vascular compromise, and then the 5th category is trauma. Each of these 5 categories have in common that they actually slow the development of neurite sprouting. That is, the neurons are continually regenerating, and when that doesn't happen, the neurites retract and the body goes through what's called pruning, or the networks are decreased. It presents in many different ways in many different people, and essentially what he has given us, thanks to a great deal of work, is an understanding of the mechanisms, and this has given us the privilege and the opportunity to address the root causes of cognitive decline in very different domains, and these are critical. What's unique about cognitive decline is that it's often a decade or 2 after the symptoms develop that the process has been going on. Sadly, in fact, our American lifestyle and standard American diet drive many of the causes of cognitive decline. If you have further interest, I'd recommend that you, before I do any work with folks, I have 2 requirements. First, they go to my website, and under the reference section, there's a 1 hour and 13-minute video by Dr. Dale Bredesen. It's a bit old now. It was done in 2016, but the principles have not changed. And I ask that they review that and read it, not to memorize it, but understand it. And then Dale has produced 3 books. This is his 2nd book, which is a little bit too detailed for most, and I think if you want it, it's a great place to start. But I think a better choice is this book called The First Survivors of Alzheimer's. I like this because you'll have at least 5 different patients walking you through their journey of having the cognitive decline and seeing the improvement, and in some places when they stop utilizing all the particulars within the protocol that help them recover, if they stop, the cognitive decline commences again, and when they go back to the program, it again returns again.